To this now, the City of Johannesburg is planning to have more than 70 COVID-19 testing sites. This is part of government's plan to curb the spread of the coronavirus. Gauteng is the epicenter of the pandemic in the country. More than 600 confirmed coronavirus cases have been reported in this province alone. For more on this now, I'm joined by the Mayor of Johannesburg, Geoff Makhubo, to tell us their plans of how they plan to contain the spread of this virus. Mr. Mayor, thank you very much for your time. Firstly, how many of these sites? There are 70 in total that are going to be made available in Gauteng, as I understand it. How many will be in Johannesburg?
Good morning, Stuart. Good morning to the viewers. At the moment, we have 21 testing sites in the city of Johannesburg. As you correctly point out, that Gauteng has got the highest numbers in the epicenter. The majority of those Gauteng numbers are in Johannesburg. So therefore, we want to engage in mass testing. And we are going to be increasing the sites to 79. All our clinics are going to be converted into testing sites.
So it's more than 70 that you plan to have. Capacity-wise, do you think they will be manned sufficiently?
Yes, our health workers have been trained to conduct testing, screening and all that. But more than that, we have community health workers on the ground who will help us with the tracing, the contact tracing of those who are found positive. Remember, if you are found positive, we need now to trace whoever was being we've come into contact with, and therefore we are training every person, every community health worker to help us with that.
Yeah. Mr. Mayor, tell me about the public clinics. Whose competency is it to run those? Is it local government or is it provincial government or national?
No, there are two types of clinics. There are local council run clinics, which are your PHCs, your primary healthcare clinics, and then you've got your community healthcare centers, which are provincially run. Like for now, of the 21 testing sites in Johannesburg, 14 are municipally run clinics and 7 are provincially run clinics. But we work together. We work together with province in running the clinics.
Yeah. Well, the reason I'm asking you this question, Mr. Mayor, is that the clinic in Alex, there is a reported positive case of COVID-19 there, and the fear by workers who are working in that particular clinic is that management is, first of all, hiding information from the general public who visit that facility, but second of all, that the workers themselves are being exposed to possible infection. Are you aware of this?
That's a provincially run clinic, but I'm aware of a clinic that is being sanitized, it's being deep cleaned, and PPE is being supplied to the workers. But what's happening in that CHC is that they are scaling down other activities just to focus on COVID, so on COVID testing, COVID patients. So I'm not aware that the employees don't have PPEs, but we are making sure that all our frontline staff and the health workers do have the necessary personal protective equipment.
But confirm for us whether you are aware of at least one positive case and another one that is pending.
I have not spoken to the MEC yet, but I've heard reports that there is a worker, a clerk in the hospital, in the clinic itself, who's tested positive.
Yeah. Finally, Mr. Mayor, the issue of informal traders, how do you plan to handle it in Johannesburg now that they've been allowed to trade? How's it going to work?
We have 4,600 or so informal traders on our database. And the regulations are very clear that the Department of Economic Development, which is a custodian of issuing permits, is responsible. We have in the last 2 days issued almost 4,000 or so permits, but specifically to those informal traders who sell dry foods, who sell vegetables, who sell, foods that people ordinarily find in the supermarket. Not the chesanyamas, not those who cook food. So those who sell processed and cooked foods are not qualifying to receive payments. So in our database, we left with a very, very few number of traders who are on our database as qualifying informal traders who still have to get licenses. Unfortunately, we had a run-in yesterday when people from as far as Gauteng came to our offices looking for permits, and many of them did not qualify to be issued permits. So we are tracing those few that are still on our database. Yeah. Because they have some qualifying criteria. They have to have a certificate from our environmental health officers, etc. So we've largely issued those who are not on our database the necessary permits that expire at the end of the lockdown.
What's your message then, Mr. Mayor, to those who are selling cooked meals or who used to sell cooked meals, because clearly they don't have permission to operate on the streets? What's your message to them?
My message is that the regulations are very clear. Please don't come to the Department of Education, the Department of the Economic Development in our offices looking for permits, because you will not be able to issue permits. Please, only those who sell dry foods will qualify to receive permits, and those who are on a database who have the necessary clearances from environmental health officers that qualify to get these permits. Those will not be able to issue permits to.
All right. Thank you very much for your time. That's Geoff Makhubo. He is the mayor of the city of Johannesburg.